Hello, this is Dr. Yan from Columbia Asthma and Allergy Clinic. With COVID-19, most of us are staying at home. One day you might wake up with runny nose and sneezing, then you start to get concerned. Is it COVID-19 or is that my usual allergy or asthma? Today we're going to talk about how to differentiate the symptoms among those three: allergy, asthma, and COVID-19. And also we're going to talk about how to take care of your allergy and asthma during this COVID-19 time. COVID-19 can present a variety of symptoms. I listed over here. So with fever, cough, shortness of breath, and fatigue, those are most common symptoms. Some patients might not have fever, but majority of COVID-19 positive patients, they have fever. And shortness of breath usually present at the second week of the illness. And there are other symptoms such as sore throat, muscle aches, diarrhea, nasal congestion, conjunctivitis, loss of smell, loss of taste. So you can see they can present some eye symptoms, some nasal symptoms. Fortunately, those symptoms are rare in COVID-19 patients. The outbreak of COVID-19 started in March, which is also unfortunately the start of the spring season. So allergies can be difficult to differentiate from COVID-19. Most allergic rhinitis symptoms include sneezing, nasal congestion, itchy or runny nose, postnasal drip, itchy or watery eyes or red eyes, and cough. However, cough is not common symptoms in allergic rhinitis. Some patients might have cough because of the mucus from the nose, and mucus of the postnasal drip will irritate the throat and causing the cough. As we can see, that itching part is a big part of allergic rhinitis. Itchy nose, itchy eyes, which usually doesn't present in viral illness. And also, we can see that allergies don't have fever. So I would recommend you to take your thermometer at home and start to measure your temperature if you start to have some URI symptoms. And other thing that you can try at home is over-the-counter medication. Antihistamine, especially second generation antihistamine. Those are non-sedating antihistamines such as Allegra, Claritin, Zyrtec, or Xyzal. You can start to try any of these antihistamines. And also nose spray. Take out your usual nose spray that you like, either Flonase, Rhinocort, or Nasocort. And those medications are generally safe and can be used every day if needed. If you respond to antihistamine or nose spray, then most likely you have allergies, especially when you don't have fever. When you see the trees are budding and the flowers are blooming, you know it's high in the tree pollen. And the grass pollen is followed by tree pollen in the summer. This year is a good strategy to stay at home for both your allergies and COVID-19. So when you stay at home, try to close all the windows so the wind doesn't bring the pollen inside and trigger your allergies. And pollen counts are usually high in the early morning and late evening. So limit your activity outdoor during those times. And when you go outside to have some activity, then remember to wear mask, sunglasses, and hat. Mask is a good idea for allergies and also a good idea for COVID-19. When it's dry, windy, weather is dry and windy, we know that the pollen count usually high. So avoid going outside during those times. And the pollen count can vary from day to day, so check your weather, local pollen counts with weather reports. That may be helpful. Let's talk about asthma and COVID-19. Asthma is a condition that there is inflammation of your lungs, which can cause obstruction and trouble breathing. The most common symptoms for asthma are cough, shortness of breath, chest tightness, and wheezing. Cough and shortness of breath are seen in COVID-19 patients. COVID-19 shortness of breath usually is more severe. The most important thing for asthma patients is to avoid triggers. There are a lot of triggers, and each patient has their own triggers, such as irritants, like tobacco smoke. So if that's your irritant, make sure your family member doesn't smoke inside of house. Ask them to go outside to smoke. Some patient might be triggered by the tree pollens, which we've discussed earlier in this video. And some patient might be triggered by other allergens such as dust mite, cat and dogs. So speak with your allergist to discuss how to avoid those triggers. Good news is that the asthma is not a major risk factor for COVID-19. There is no data that continuing those asthma medication will increase your risk of getting COVID-19, or even if you have COVID-19 with those medications, it doesn't worsen the outcome of the illness. It's important to be consistent with your current asthma medications. Go back to your asthma action plan, see if you need a second inhaler to add on. And another recommendation I would give is if you have peak flow, try to measure your peak flow every day and monitor your breathing. Peak flow is the simpler version of breathing test that we usually perform at our office. So this is a handy tool at home to monitor your breathing. If you don't have peak flow, discuss with your allergist, and we may be able to prescribe one for you and educate you how to use it. Let's review COVID-19. Usually COVID-19 will have a fever and take a temperature is a good idea. And allergic rhinitis, you respond to antihistamine and nose spray, so you can start with those medications. And asthma, go back to your asthma action plan, use albuterol as needed, and then monitor your breathing by peak flow. If this medication doesn't seem to work, then it's a good idea to get in touch with your doctor. Columbia Asthma and Allergy Clinic, we do televisits, either by phone or by video, so feel free to make appointment if you have any questions about your symptoms. Again, stay at home, wash hands, and practice social distancing. Stay home but stay connected. Hope we'll see you soon. Thank you for your time.